Hey guys, welcome back. As I promised, we're doing a mini series on root cause for hair loss. And today I'm so excited to have a fellow nurse practitioner with me from Memphis, Tennessee. She has a practice in Memphis that she owns and runs, and she's been treating hair loss for about 8 years. And so we're going to talk to Renee about all of her treatment strategies that she has available for hair loss. So thank you so much for being here. I'm excited to kind of dig in and find someone else that's treating hair and has a passion for hair loss, because it can be challenging at times.
Oh, it's one of the most rewarding and challenging things that we do in the practice.
Absolutely.
Sure.
So
Thank you so much for having me.
You're so welcome. So are you seeing what I'm seeing? Are you seeing an increase in complaints of hair loss? Are you seeing more people coming into you for hair loss?
And younger patients, younger in both sexes, women and men.
Right.
For sure.
So what do you think is responsible for that?
Oh, I could say many things, but I'm going to say diet like 3 times.
Good for you.
Just inflammation in general. I mean, things that create inflammation in our body is going to create not the healthiest environment for hair. And I really feel like I have a passion to tell people about making sure their diet is filled with minerals and vitamins and protein and all of the core things that we just don't get enough of, whether we're just are eating junk food or we're trying to lose weight, or the ground just doesn't have it the way it used to when our ancestors had lots of hair. My dad has a head full of hair. But I think that there is a DNA code to that. And I know that with my Black women, I find that they are my hardest patients to treat because of that DNA. Not even necessary from scarring alopecia, but just from that DNA code.
So they seem more challenges with DHT-related hair loss in that subset of patients?
Oh, totally. But then there seems to be also you get all of those things kind of checked off, and they're still having a hard time, even though they are optimized. We do a lot of wellness. We don't really practice a lot of functional medicine yet. That's coming. But we do hormone therapy and we do weight loss and wellness. And so if we can't treat them, then we do refer them to a naturopathic doctor and make sure that we can support them all we can. But that is my most challenging population for sure.
Yes, yes. So as you mentioned, it's affecting both men and women. Right? We used to see more men than women. And I think today we're seeing probably equal amounts of both men and women, all races, right?
Yes.
All socioeconomic levels are affected as well. And it can be quite devastating when we start seeing hair changes that we don't understand root cause. So I'm really excited because my practice is functional medicine, right? We start with food first approach. So it thrills me to hear someone in the aesthetic space that really understands that. That's music to my ears, because I think a lot of patients are just told, put this cream on, take this pill, maybe go use a red light, but they're not really, maybe have some steroid injections, but they're not really taught what's driving that hair loss and really how much control they do have with their fork as far as what they're eating, how they're digesting that food, and able to get that nutrition to the follicle itself.
I get so many people that come in and they're just like, well, how long do I have to take these vitamins? And I'm like, until you aren't here anymore.
Right. As long as you want hair.
As long as you want the hair. Like it's, and I think that was also one of the hardest things for me to translate for my patients, because even though, you know, in aesthetics, we say all the time when you're doing things to your skin, nothing is one and done. And I really wanted, in the early days of me trying to understand hair loss, I kept thinking, well, I'm going to unlock this code and I'm going to grow that hair. And I know there's maintenance to all things that we do in our lives, whether we're going to the gym or whether we're trying to maintain our skin or whether we're trying to maintain our hair. And I think that was my biggest challenge in the beginning, because I'm so used to saying, if we do this to your skin or you eat this way, then I can help you either lose weight or I can help your face look better. It's like hair is a whole different thing. It's like I can't make any promises. And I love to make not promises, but I want to give results.
Right.
And results aren't always promised with hair restoration. And that's why I tell all my patients, I'm like, we've got to throw all of our tools at it. And in the early days before Derive, I know we're going to talk about that, but in the early days before Derive, we really didn't have anything that would decrease inflammation. That was the whole reason that we used steroids. And so I've used steroids and PRP, and I would make these elaborate, wonderful treatment plans and, get them on 10 months of treatment. And I mean, we've really customized all of these things, and seeing how Derive has so greatly impacted the inflammation level of the scalp in a good way. I'm just like, I'm so impressed, and it's hard to impress me at this point.
That is awesome. So let's dig into that because, for our listeners, Derive is what I was talking about in episode 1. Derive is plant-derived stem cells and exosomes that helps the body repair itself. And Renee just said a mouthful when she said that in prior years, we've had tools like hair light therapy, red light therapy to help remove DHT. We've had medications that remove DHT. We've had platelet-rich plasma that helps regrow the hair follicle and nourish that hair follicle. But we haven't had a tool that was not only in clinic use, but at home use that would target inflammation. And she also pointed out that inflammation is driving a lot of this. Post-COVID, I saw a lot of hair shedding, a lot of massive hair shedding for people post-COVID, seeing it also with the use of GLP-1s. So the weight loss medications, Ozempic, Mounjaro, we're seeing lack of nutrition affect hair. And so talk to me a little bit about how Derive helps with inflammation in general at the scalp level.
So I want to make one little extra point because I do use the GLP-1s in my practice.
Yeah.
And I was in the weight loss space before I got in the hair space. None of my patients have reported hair loss. And I've been doing this for 3 years. I've had one patient when she stopped doing GLP, about 6 months later, she said, Renee, I think my hair is shedding. But we really, again, help and support that patient from a nutritional standpoint. And they have to go through diet coaching with me to get their GLP. And I think that makes a huge difference in the side effect profile from those medications with hair loss.
Yes, I totally agree with you. And I see that too. Patients that are really investing in nutrition and they're taught from the very beginning that they need to prioritize their protein and they need to prioritize their micronutrients. And supplementation, I'm sure, is part of that too. Yes. You probably prescribe very specific supplements to supplement the diet so that they don't get the consequences, the negative side effects that can happen when they don't pay attention to nutrition. Yeah. So good job there.
Okay, but we were going to talk about Derive. Sorry.
No, that's good. That's really good. People need to hear that. People really, really need to hear that. We have a full podcast episode on my other platform, Synergy, where we talk about, are GLP-1s a menace or are they a miracle? Right? And I think they can be either, depending on how they're used, right? How patients are educated on what their priorities are, especially in the nutrition side of the equation. And if they're taught to eat long-term, not just to lose weight, but how do you eat long-term to support the body in general? So I love that.
Totally. Yes. That's I get to do all the things that I love to do.
That's good. That's
it's a great thing.
And I'm like you, I love to see that hair grow. It's one of the most rewarding things you ever see, other than growing babies. I say I love to grow babies and I love to grow hair. But when you see that hair coming back in and it's healthy and you see the smiles on those patients' face because they do have restoration, it does make you feel good.
So I kind of went on a journey because I was, primarily doing PRP, injections and steroids. And we were doing, different combinations of, exosomes was making their way into the scene. And this was going into COVID. And so, reading and doing my research, I was like, we're going to have to find an exosome. Because again, as we're going through COVID, my own husband is a patient and we went to draw his blood and spun it, and we were getting ready to do his PRP, and it looked like cholesterol in a tube.
Oh, wow.
And he had recently had COVID. And so that even got me thinking again. I'm like, okay, this is supposed to be the best for that root and to help regrow. But if this is not as healthy as it needs to be, our platelets,
Yes.
then what are we going to do? So that really kind of shifted me into what can I find? And so this particular XOE that makes Derive only had the skin formula. And so I was like, okay, whenever you get the hair, you let me know. I want it. I want it. I want it. I even started microneedling in their XOE,
Right.
which is mostly based for skin, but it was the anti-inflammatory things that we were trying to put into the skin. And from that point on, I really stopped using steroids. I didn't need them.
So you started seeing changes
so,
even with the XOE formula, which I think is phenomenal.
Just with the XOE.
Yeah.
Yes, yes. And even with that, I'm actually adding that XOE back into some of my patients that I feel like they're getting into the Derive, and I'm just not seeing that wow that I want to see.
Right.
We're adding that XOE in with the Derive treatment
Love it.
too, so they're actually getting both the Derive and the XOE. It's EXOE, but I call it for short. So
we do too. We say the same thing at our clinic.
Okay. And so, I really, at the time, the Aquafarm machine wasn't even available. And so we were just microneedling it in. And when they brought the machine to me and they were just like, Renee, you don't need to use a needle anymore. And I'm like, wait a minute.
Right.
Nothing's better than a needle. And then I saw the results. I couldn't believe it. With patients, PCOS patients that have diffuse loss.
Right.
You give those women back their hair, like you said, there's nothing better.
There's nothing better.
Just incredible to see the results.
Yes.
And even as I like to use my husband as a reference point a lot because he was my very first patient. After using the Derive, I think that it made the PRP work better. So I still am creating packages with both treatments.
That's awesome. That's good. So let's talk a minute about PRP because that was kind of my entry point too, was platelet-rich plasma. And you said a mouthful when you said, you're only as healthy. It's only going to work as healthy as you are. So when you drew his blood, he had COVID. He had a lot of inflammation. You could see the changes.
Oh, yes. You could see it.
Yeah.
Yes.
So talk us through a procedure for PRP.
So we go and we draw. We use the same company with aesthetic management practice. We use their PRP kits.
Yes.
And we use a 22 ml tube.
Right.
And so we have several steps that we take to separate the platelet rich from the platelet poor.
Right.
So we're only injecting back into the scalp the platelet rich plasma. And that's another thing. As I always tell my patients, I'm like, you've got to come in hydrated. We'll be happy to do an IV for you a couple of days ahead of time.
Right.
It makes a big difference. And my young patients, especially my young guys, I kind of joke with them. I'm like, more water and less beer, please.
Right.
Because you've got to give me
just for a week or two before, right?
I want to get all the volume that I can. It gives me more to give you back.
Yes.
And when you explain that to them, they're like, oh, okay, I will. Because they want to be a participant in it too. They want the best outcome that they can. So they're usually pretty compliant like that.
And when you do your PRP, are you also microneedling as well?
Depends on the hair pattern.
Yeah.
It really does. Because if the hair is there and we're just trying to thicken it, I find that depending on the technique of the the microneedling, I don't really want to tug on the hair a little bit. I don't really want to, so I find myself stamping or just injecting. We have Pronox, and so we have different things that we can use to help the patient relax. We use a lot of diversion, and we're just like, we're going to get you through this.
Right.
And so, kind of depending on our treatment pattern, we just kind of get through it.
Right.
What about you? Do you microneedle it?
Most of the time, yes. Not always, but most of the time I will do microneedling as well. I find that it does stimulate that follicle a little bit better. And I typically see better results when we microneedle, but it is touchy, right? That scalp is very tender. And so I was like you when I found out about Derive and that we could put Derive on the scalp and drive it in with ultrasound technology. It was like Christmas. I was like, I can't get that machine fast enough because there are some patients that just don't do well with the pain of PRP. And if we've got another modality that works and gives the same efficacy, if not better, then I'm all for implementing that. And so,
What's funny is I have about 5 patients I'm trying to convert over.
I know,
like,
it's been the same thing.
And they're like, oh, no, we like
Yes.
this. I'm like, I don't have to stick you. It's going to be okay. No.
No, I have one as well that I've been doing PRP on since 2012. And she gets her PRP routinely. She's got beautiful hair. She's maintained her hair. And I tried to convert her over and she was like, I mean, that was good, but I want to go back to PRP. And I was like, that's fine. That's fine. You can do that.
Yeah.
And so I think whatever works for them, whatever makes them feel confident. I'm just blessed that we have all the tools in our toolbox that we have that we can implement whatever we need to use whenever we need to use it. So are you using any red light therapy?
I do recommend that my patients purchase a red light. I elected not to sell them from my practice,
Sure.
just because people think they can go on Amazon.
Right.
I do think that it helps. I mean, I think that, again, it's that same process. It's decreasing the inflammation. It's giving them a daily treatment if they will do it.
Right.
I think that when you are fighting it, it's a journey. It's not just what do they say? It's a marathon, not a race.
Right, right.
And so investing in a very good light, I think is helpful.
Mm-hmm.
But I don't sell them from my practice. I just make some recommendations on brands and things like that.
Yeah, so we were pretty old school in that we bought a red light. It looks like an old-fashioned hairdryer that you would see in the hair salon back in the day, but it's red light. And so we'll have patients come in and use that weekly for a few weeks to get their confidence up that if they purchased a red light, that it would work for them, that modality would be worth the purchase, because a real good red light therapy device is expensive, right?
Yeah.
And you want to make sure that modality is going to work. So we have kept that device. We've had it for many, many years. It works really well. And so it's a good demo for them to see kind of what the red light has the capacity to do for them. So I like having that. But I'm with you. There's so many products online that they can go and purchase today. It can be really confusing to them because not all red light is created equal. Not all red light works, right? Because it's not the right frequency to address that hair follicle. So,
and even if you tell some of them, they still don't listen. So you're just like, well, all right, keep coming back.
Right?
We'll just
you may learn,
you.
right? So what about medications? Are there any medications that you're using adjunctively with your patients for hair loss?
Other than a nutraceutical and other than a nutritional supplement, I don't prescribe a lot of finasteride. Now, I do have patients that have asked for it that are younger, and if they tolerate it well and they're happy. I just saw a young man that is in dental school in Memphis. He's from another part of town, but I've been his practitioner for his hair. And he was coming in for like a follow-up, and it had been a year since we'd seen each other or anything. And he'd transitioned his care back with the finasteride to his primary care, and I was covering that when we were treating him for 2 years. But he's super happy with his hair still. Like, he's
good.
He's still using some topical. I have tried to get him on the Derive, but he came around before Derive was ever even in our office. So he's still happy with his Nutrafol Exo, or they have an Exosome serum as well that we sell. And so he uses that, and he takes his finasteride, and he's very pleased with his hair results.
Yeah, I'm with you. I haven't used a whole lot of finasteride in the practice just because of the risk of hormone imbalances for men primarily.
Right.
That's something
it's not my go-to.
Yeah, it's not my go-to, especially when we have such better tools to use today than we've ever had. Yeah.
Totally.
Good to know. What about, do you have any practitioners in your area that are doing hair transplant? Do you see many patients that go the transplant route?
So it seems interesting because we don't really have a large practice in our area that is really performing a lot of transplants.
Yeah.
When we first got into this space, we literally, this was prior to COVID, going into COVID, we started looking at machines of maybe how we could do, even in our office, like hiring in a physician to come in. I mean, we kind of looked at a lot of angles when we decided to get into hair because, again, there wasn't anybody in our area. A lot of the patients that I see have gone to either Atlanta, to the Bosley hair studio there.
Right.
And then I get from time to time just a large group of, it'll be a brother, son, uncle that have gone to Turkey. And, you know, they're told over there, find a PRP provider. And so over the years, it's like I'll keep getting referrals from from a family or something. They'll be like, oh, now my so-and-so is going to come see you. And it's like, okay, you know,
right.
You probably need to come back and keep your hair transplant healthy, but okay, thanks for the referral. So I've seen a lot of those too.
Yeah. So hair plant transplants have come a long way. You know, back in the day, it was strips of hair that they would take, and now they can actually take a single follicle one by one. So it looks a lot more natural than it's ever looked. And so there are centers in big cities. I wasn't sure about Memphis. We had an area here that was doing hair transplants, and that physician has now retired. So we don't have anyone in our area doing transplants, but it is a modality.
It's a robotic
yeah.
thing that just does the FUE. It's remarkable.
Yeah. But for people that have had progressive loss where those follicles are completely dead, that is a way to restore those follicles. And to your point, once you have a hair transplant, you do want to do things to keep that tissue healthy, right? So using things like Derive, using things like PRP can help preserve that investment that you've made. So if you've had a hair transplant in the past and you're looking for modalities to help keep that investment going, then using something like PRP or Derive, in addition to some red light, would help keep that healthy.
Definitely. Yeah. I was thankful when I started noticing people looking me up online for those reasons and thinking, okay, they're really giving them better information in hair transplants. You know, right. Sometimes they just were sending them out and
not really a whole lot of education.
Teaching them. I think they're doing a better job.
So it sounds like you have a real passion for educating your patients, which I just adore, right?
Thank you. I was a nursing educator for stem cell transplants at St. Jude.
Oh, so there you go.
That's just part of my DNA. It's like I want my patients to know the why. And
right.
Sometimes they'll gloss over and I'm like, okay, I've gone too far.
Right. So I think it'll be helpful to go into maybe some discussion around inflammation in general. So we kind of threw some things out at the beginning of the podcast of reasons why maybe inflammation would be higher. The things that come to my mind first are sugar intake. You know, as Americans, we are consuming excessive amounts of sugar, and oftentimes it's hidden sugar. You know, I see people really trying to eat healthy. They go and get their green juice, and they don't realize that 3/4 of that green juice is actually pineapple juice, and they just put some, green colored vegetables at the end to kind of give it color, but it's really a lot of, fruit juice. And so it's not hard to eat too much sugar is my point. And sugar is probably the number one inflammagen that's out there that's easily accessible on a day-to-day basis.
Well, and I think that then that brings into a whole other level of insulin resistance.
Yes.
And so anytime you're looking at sugar, and what it's doing internally, the hair follicle can't live with that much inflammation. So you definitely have to start on the inside and kind of work your way out, of course, but it's hard sometimes to get someone to understand that what they're eating is creating an environment that their hair won't grow.
Yes.
It's also very hard for someone that is taking testosterone to understand that whether it's overseen by someone like me that is doing it the right way, or whether they're going just and getting a shot somewhere and buying it on the internet. You see what I'm saying?
Yeah.
It's always bringing it back to what is going to create the environment for this hair to thrive and to grow, which is another thing that Derive does, that actually cleans the hair, or it cleans the dead cells from around the follicle. So they're not just getting a hair treatment, they're also getting a good scalp treatment. And I think that helps to decrease the inflammation too. So it's like, it's got to be a diet thing. You've got to have that conversation.
Right.
But then also helping them understand that this ongoing treatment at home helps what I do in the office too. And just kind of getting them on board and getting them to understand that whole piece, that it takes both. It takes what we do in the office and it takes what you do at home. And so that's the journey really is converting
that partnership,
getting believers.
Yeah. So when you talk about the inflammation around the follicle, I'm amazed. We use a dermoscope in our practice to actually look at the hair follicle and look for miniaturization, look for, is that follicle getting vascularization? Do we have enough blood flow, right? Is it nice? Is it slick and shiny, or is it nice and pink and, healthy? And you can actually see after one treatment the difference. And I was amazed by that. I did not expect to see such a dramatic change on dermoscope with inflammation.
It's mind blowing.
Yeah, it really, really is. It was kind of a fun thing to watch. And normally we wouldn't do a dermoscope before and after a procedure, but I'm just super curious. And I'm like, I want to see what it does right after the procedure. So let's walk through the derived treatment, because you brought up the way that we clean the scalp. So let's talk about the in-office treatment process.
So the treatment consists of several steps. And I like the part of the scalp health, of the cleaning of the scalp, removing the dead the dead cells from around the follicle. And then, it also increases the circulation.
Yes.
With the treatment itself. It's bringing suction and cleaning, and that just drives circulation, which is something that we need to do. I tell my patients, I'm like, this is a mini head massage. When you put your Derive on, just use it as a mini head massage. And so once you get the scalp clean, you're pushing that Derive that's very specific to grow hair. It's sending that signal and that receptor from the hair follicle to say, grow, be healthier, grow, be healthier, grow, be healthier. And so we do that treatment 4 times. We typically are following the protocol that they provided for us, which is 3 Derives in the office, 4 to 6 weeks apart. We usually give them a month break, and they do take the at home during that time. And when we come back in and do the 4th Derive in the office, and then we go ahead and keep them on that Derive. We sell a package, like a 6-month treatment plan.
Right.
When we do it in our office. There have been several times where patients have come in and really don't want to do something that they don't know what's going to come, and they don't understand the fact that they're not going to have their head stuck, because this is what they've done their research on.
Right.
And I love them coming in and asking me questions. And sometimes we've added, I usually say if the patient has PCOS, 9 times out of 10, I'm going to do both treatments on them. I've had a couple of patients that have done one or the other. I still feel like that sometimes both are needed.
So you're saying both PRP and Derive?
And Derive.
Yeah.
I have a young man who's done Derive. I don't think he finished it. I think it was a clinic. I don't know. He's driving into Memphis to see me. And I feel like they felt like there was some help, but he's 20 years old and his father is bald. And so we're trying to regrow his entire scalp. And so we have him on Derive and PRP.
Yes.
So we've extended his treatment to closer to an 8 or 9 month plan.
So it's nice that you can layer those treatments depending on what that patient needs, right?
Yes.
You can actually monitor, see what they need, and kind of modify as you go. We're
hand-holding them. We see them at least every month. And we're following up with a phone call. It's hard when we don't see the results that we want, and then we kind of take another deep dive. It's like, okay, what else are we missing here?
Right.
Do you find that other than your dermoscope, what are you really doing? Are you doing biopsies in your office?
I'm not doing biopsies in my office. We do have a local dermatologist that will do scalp biopsy, and sometimes that's helpful. But I find typically with the dermoscope, we can pretty much know what we're dealing with using the dermoscope. But occasionally it helps them, I think, emotionally to see the biopsy report to know,
Yes.
oftentimes they want a name for something, and to see that biopsy
Yes.
report and know that they're using the right treatment strategy for the particular hair loss that they oftentimes have. So, yeah, I don't dissuade them from doing that at all. What would you say about your 20-year-old what would you say to a 20-year-old that's starting to see hair loss and regression, whether they're male or female?
My patients know that I'm in it for the right reason.
Right.
When you meet with me and we're doing your consult, but I feel like that it's kind of it's a catch-22, because I can't promise that he's going to have that head full of hair that he probably sees his friend have. But you'll be surprised how much more confidence someone has, even if you can help them 30%.
Right.
If you can give them 30% more hair, it's not 100% more hair, it's 30% more hair.
Right.
It's that confidence level that comes, and that's not really based around an age, 20-year-old or 50-year-old. I mean, it's that same piece of just giving them more confidence about their hair and their hairline. And he's the one young man that I was referring to earlier about the PRP combo. He was just in my office, and so he's on my mind. I'm really, really hoping big things for him, because I want to deliver. I want, him to say, oh, this was worth the drive
Right.
from Oxford up to the office in Memphis, and look at my head of hair. I've had several young men that their mothers will bring them in, and they're like, well, we're not going to spend money on daddy because daddy's too far gone. We're going to invest our money on son, kind of a thing. And I've had lots of success with more of the widow's peak, more than just the diffuse, as you probably already
Right. Yes.
know too.
Yes.
I've had patients that have said, hey, if you can just close some of my hole, I'll be happy.
Right.
Everyone has a different level of success in their mind about what they're willing to say, oh, I'm so happy with this. It doesn't always have to be what I think it should be, because I'm going to go for 100% every time, even if I know I can't give 100%, I'm going to try to grow every hair on that head that I can.
I love that. I think having those conversations of what are their expectations? I think that's an important conversation to have. So if you're a patient having hair loss listening to this, I think just thinking about that, what does success look like for you? Knowing that your provider is going to go that 100%, because I'm like you, I want to see the hair grow. I'm not satisfied until I figure out if there is a root cause that we have not addressed, right? And what can we be doing to maximize hair restoration for that individual? And so that's always part of the conversation. It's what are you expecting to get out of this? Let's set some realistic expectations and know that we're going to do our best to get the hair back. When you see diffuse hair loss in a female, say postpartum, I'm thinking about our menopausal patients or our perimenopausal patients, where they start seeing not only hair shedding, but a lot of times changes in quality of their hair. I used to refer to that, the 40-year-old hair, right? It just changes at age 40, right?
Well, I call it menopause hair. I also have thyroid hair. So you throw thyroid and perimenopause,
yes.
and you've really got a combination. That doesn't scare me, because I know that Drive and PRP are going to work for those patients.
Yes, that's what I was going to say too. I feel really confident with that subset of patients, because getting their hormones balanced.
That's going to be the key.
Yeah.
And I look at that even for my hormone patients when they come in and they're like, oh, I feel so bad. And I draw their labs and I'm like, hey, at least I can make you feel better.
Yes.
I would much rather have a reason that you're feeling this way than not. And when my perimenopausal women come in, I'm like, girl, we got you. We can do this. I've had a lot more success with them than I do even my PCOS patients. And I strive to make sure that they have that confidence too with that. And they have diffuse thinning hair too. PCOS patient, it's a hormone thing.
Yes.
And a testosterone thing and an insulin thing. It's all the things.
Right. So yeah, I find that hormone shifting patient oftentimes gets dismissed. because they don't necessarily have their scalp showing. They may still look fine to everyone else, but they don't look fine to themselves. They know how they used to look, and they're not happy with the wide part. They're not happy
when the part
with
starts widening. It's like, hold on now.
Right. Just know that is much easier to treat, to your point, and it's so much fun to treat when we can see that clock be dialed back by getting good hair quality restoration.
And sometimes I find myself looking for a nice way when I'm looking at other things with people. So whether it's weight loss or whether it's aesthetics and I'm standing there looking at their face and scalp and head, I'm like, I really have a hard time because I don't ever want to feel like I'm pointing out something.
Sure, 100%.
But then I'm picking those directed questions to kind of see if it's something that bothers them. And only to start a conversation, because a lot of times patients will come in and they won't realize that they're coming to you for one service. They don't realize the other things that are going on in the practice.
Right. Absolutely.
So it's just a way to kind of just really educate. Everything goes back to that for me. Everything goes back to that.
Well, this has been really good. I appreciate your time and your expertise. I love finding someone else in the wellness community that has as much passion for true health and wellness, for making sure that we're not just helping our patients look better, but they are actually getting better. That's always a big part of our conversation, and I just appreciate you being here. Are there things you wanted to let us know about your practice specifically? Do you have things you want to put out into the community for our listeners?
We're in Memphis, Tennessee. We're right in the heart of the city. We've been there for almost 10 years. We're full service med spa and wellness. I equally have weight loss and hormone and hair patients as much as I do aesthetic patients, but we offer a wide variety of services, from laser treatments to laser hair removal to hair restoration to hormone therapy, IV therapy. So we're really a full med wellness clinic. We want to make you feel good and look good from the inside out. It really is about making that patient feel well and be beautiful at the same time.
Awesome. Well, I know this is going to be a success for our patients. For you guys that are listening to our mini-series on root cause for hair loss, I appreciate you being here. Send in your questions. We want to hear from you so that we can take a deep dive and make sure that we're answering all of those questions that you have related to the hair quality and challenges that you're facing.